MSF has been using antiretrovirals to treat patients living with HIV/AIDS in the district of Zulu for over 10 years. The teams have gradually set up a programme able to screen and treat patients throughout the district and are now preparing to hand over most of these activities to the Ministry of Health. But before they do, the teams want to evaluate the impact of their action by measuring the incidence of the disease.
Incidence means the number of new cases in a given period. In other words, determining if those who test positive have been positive for, say, 10 years, or if they've become positive in the past 6 months. There are new tests that have just come out and that are still in development, and MSF, through its epidemiology research centre Epicentre, wants to participate in this development and is trying for the first time to quantify transmission. Has transmission decreased or is it still at a peak?
7,200 participants were randomly selected for the survey, which had questions on disease, prevention and treatment. The participants were then tested. The first test screens for the HIV virus. The second assesses the conditions of those who are HIV positive and the impact of their treatments. And the third test establishes how long the individual has been HIV positive.
What's new is the size and scope of the survey, using incidence rates and having access to extremely precise data on HIV from the actual population rather than from patient cohorts and health centres. It means we have a real population-based survey on HIV.
Thousands of data are being collected and analysed. They will give us an accurate picture of the status of HIV 12 years after the advent of the first treatments. Jordan, situated right in the heart of the Middle East and used to hosting refugees, is where in 2006 MSF decided to set up a hospital specialised in reconstructive surgery. Initially, patients were Iraqis wounded in the conflict that continues to devastate their country, but they were soon joined by Yemenis, Gazans, Libyans and Syrians. Most Iraqi patients are victims of violence, with bullet wounds or injuries caused by explosions.
I was injured in a car explosion in Mosul in 2008. My entire nose was blown off. I joined the MSF program in June 2012.
The surgical team treating these wounded patients is highly specialised. Orthopaedic and maxillofacial procedures are commonplace. Around 50 new cases are treated every month.
Many of our patients, they came with the resistant bacteria. With this bacteria, it needs new versions of antibiotics. We offer this for the patients. We want to receive more patients with more cases from Iraq. The service here it's grown more than before.
The project provides much more than surgical treatment. Patients receive a comprehensive care package that includes physiotherapy and psychosocial support. After being hospitalised, sometimes for several months, the patients return home. The issues they then face regarding long-term rehabilitation, integration and stigma remain unresolved. These jerry cans lined up at water points illustrate the long hours people spend queuing for water. Some refugees in Yita camp have to wait all night for just a few litres. It's over 40 degrees in the shade and it hasn't rained for 6 months. The camp now spreads over more than 12 square kilometres. Refugees continue to pour in and the aid workers are struggling to keep up. Water points and latrines are still insufficient, so the refugees will need jerry cans, soap and plastic sheeting to maintain acceptable levels of hygiene during the impending rainy season.
We're seeing lots of cases of hepatitis E, so we need to act quickly and provide latrines and raise awareness among everyone here. We have a big team and 50 people go around the camp every day promoting hygiene and sanitation and explaining what the disease is.
The rains start in May, which means that health and hygiene can only get worse. Getting supplies to the teams will be a logistical nightmare because roads will be flooded.
The rainy season usually starts around May, and there's every possibility that the camp will become inaccessible between now and November and December due to the flooded roads. So we preferred to play it safe and place our international orders on the basis of 100,000 refugees in the camp before the rains began. We've also done a considerable amount of work in our hospital. All our tents have been up for a year and a half, so it was high time to replace them. We're in the process of building a temporary facility, a metal structure with roofing that will withstand the storms.
MSF is also organising a vaccination campaign for some 9,000 children under the age of 2 to limit the risk of infectious diseases. Even when the disease isn't at its rainy season peak, Lear Hospital constantly has around 50 patients suffering from Kala-azar to treat. Transmitted by sandflies, Kala-azar weakens the immune system and, unless treated correctly, it proves fatal in almost 100% of cases. But even so, the disease has yet to be put in the spotlight and people travel long distances for treatment in South Sudan. When the usual treatment fails, or in cases with severely ill patients or pregnant women, MSF uses the drug ambisome, which shows very positive results. But the cost of ambisome is a significant barrier.
We could not give it to everybody because it has to be used in hospital. It needs skill, and also it is very, very expensive also to be used unholy, and that is why there's some limitation.
Diagnosis is a challenge too, and when patients are successfully treated, there's a risk of relapse. While a rapid test is available, it cannot detect such cases. Testing requires well-trained medical staff, a significant challenge in a country like South Sudan. The World Health Organization estimates that there are 500,000 new cases and 50,000 deaths caused by Kala-azar worldwide every year.